My name's Pete Hailstrap. I'm a family physician and part of Kajabi Hospital's online learning team. Today we're going to have a very brief look at a top tip for how you manage sore throat. This is a condition most of us seeing very regularly in our clinics. A child or an adult comes in with a short history of a sore throat, and we're trying to decide whether we should give this child antibiotics or not. We're going to look at this topic because it's a common presentation but can have its own challenge of knowing when it is appropriate to give antibiotics. And that's because we know that in the majority of cases, the sore throat is viral in origin and antibiotics are going to make no difference to this patient's outcome. In fact, it's only about 15 to 30% of all cases of sore throat that are due to a bacterial infection, most commonly a group A streptococcus. However, we don't want to miss those cases that are bacterial because we know that group A streptococcus has been associated with rheumatic heart disease, and this obviously has long-term complications. So we don't want to miss those cases. We're balancing that though with the global increase in antibiotic resistance and of course the side effects of antibiotics for our individual patient. So how are we going to get that right? How do we balance not missing the cases who are bacterial and need antibiotics, while also avoiding overusing antibiotics when it's inappropriate for viral infections and therefore contributing to the increased risk of antibiotic resistance and of side effects for our patients? Well, of course, one option would be to test every single patient that came into us, swab their throats and detect it. But actually, that's not realistic for most of us, and we don't have those resources to be able to do that option. So what can we do instead? Well, wonderfully, there are a few scoring systems that can help us decide whether it's a bacterial or a viral infection. The two most commonly used are the fever pain score and the CENTIL criteria. And we're going to look at the latter today. So who can we use this CENTIL scoring system in? Well, it's been shown to be effective as an assessment in children over the age of 3 and in adults, and with patients with a sore throat for less than 3 days or 3 days or less. It's made up of several different criteria that we then score the patient on. So we look to see whether the patient has a fever. If they do, they get a point. We look at the tonsils themselves and see if they look swollen or whether there's any pus on the tonsils. Again, if they're swollen and there's pus on the tonsils, they get a point. If they don't have a cough, they get a point. And that's because often if it's an isolated bacterial infection of the throat, these patients don't have other coryzal symptoms such as a cough. We look to see if they've got cervical lymph nodes, which are tender and swollen. If they are, again, they get a point. And then depending on their age, they can also pick up points or lose points. And this reflects the most common age groups to see bacterial infections in. So if they're between the ages of 3 and 14, they gain another point. If they're between 15 and 44, there's no points. And actually over the age of 45, where bacterial infections are less common, they lose a point. Once we add up the number of points they score, we'll get a total. And this total has been shown to correlate well with the probability, the risk of them having a streptococcal infection. So if they have no points, the chances of it being a bacterial infection are between 1 and 2.5%, so extremely low. Whereas if they're scoring 4 or more points, then the risk is above 50%. So this can give us now a good idea of how likely we are to be dealing with a bacterial infection, which would benefit from antibiotics, versus a viral infection. So when should you actually give antibiotics? Well, most guidelines would say if they score 3 or more points, then there is a benefit of giving them antibiotics. And that's what I would be recommending as well. So I hope that's a helpful quick overview for you, helping you to decide when you're going to use antibiotics in these children over 3 and adults with a sore throat of less than 3 days duration. If you want some more information about that, you can look at Kajabi Hospital's website, where you'll find guidelines on this, as well as on many other conditions. And I hope too you'll continue to look at more of the educational resources available at Kajabi Online Learning Team. And if you've enjoyed this video and the material that's being produced, please do like and subscribe. Thanks so much.